We are talking about 3 healthcare hacks you need to know about. 3 healthcare hacks that you need to know about. So many people ask me all the time about what's the smartest way to approach healthcare? What's going to be affordable? What's going to help me save money? Why am I paying so much with insurance? Well, if I don't use insurance, what about this or that? So I've got it, y'all. I'm here to share. Drop in the chat, where are you joining from? For those of you who are new here, I'm Dr. Jade. I'm a board certified family medicine physician. I am the founder and medical director of Inspire Primary Care here in Las Vegas. We provide quality primary care, membership style primary care with your healthcare team at your fingertips. Our mission is high quality healthcare. Here in the Las Vegas Valley is where we're located, and we also do telehealth in Illinois, Missouri, Wisconsin, and Florida. So it is our pleasure to serve you, and today we're talking about 3 healthcare hacks that you need to know about. So if you're wondering, how do I approach this healthcare system in a smart way, in a tax efficient way, in a way where when I need care, I can access it and I'm actually not paying more than I need to be paying, then lean in, okay? This conversation is for you. And drop in the chat. I see you guys joining. Where are you joining from? Okay. All right. So number 1 healthcare hack to know about, all right, is we need to make primary care the foundation. Now, I know that you're thinking, well, you're a primary care doctor. Of course, you're a little biased. But no, that is actually how healthcare was envisioned, imagined, how it was created at the beginning of time before insurance companies monopolized the situation. Primary care has always, it's in the name, right? It is the primary place you're supposed to be able to easily go for healthcare concerns and healthcare needs. So all of you watching right now, my question to you is, do you have a healthcare home, a primary care healthcare home that is easy to reach, that is easy access? It doesn't take you forever to sit on the phone. You're not sitting in the waiting room for a long time. You're not waiting months for an appointment. Do you have a healthcare team that knows you, where you don't have to fill out the same form every time you go in because they don't know you, or a new doctor or a new provider is there every time? Do you have a healthcare home and a healthcare team that knows you, that is easy to access, where when you have a primary care concern, meaning urgent care concern, chronic care concern, something has popped up, your health screenings, etc., when that happens, do you have a healthcare home you can easily reach? Okay. If the answer to that is no, that's the first healthcare hack that we gotta fix. All right. And I know that membership style healthcare may be a newer concept for many. This concept has been around over 20 years. And it's really a way to make healthcare accessible and affordable. I know for some, they're like, isn't it going to be more affordable to use my insurance? And the answer to that is no. Insurance is going to make things more expensive in many ways, not just in the primary care office, but with every aspect of your healthcare you use. And so the structure or the strategy is make primary care your foundation. Establish with a primary care home, and many are realizing that a membership style practice is going to be the smartest strategy. This is what we're sharing with busy professionals, their children, their teams, their businesses, their parents. This is the bread and butter, baseline. This is the cake of what your healthcare plan should look like, okay? Or your healthcare for yourself. If you have questions as I'm going, drop in the chat any questions you have. But definitely look into membership style primary care for the foundation of your healthcare solution, okay? And of course, if you're in the Las Vegas area, or if you're looking for a telehealth based, and we have a physical office in Las Vegas, but if you're looking for a telehealth based, if you're in Illinois, Missouri, Wisconsin, or Florida, we would love to be your healthcare home, all right? The foundation, so the things you need, easy access. Here, Team Inspire is an easy text, email, phone, video, or if you're in Las Vegas or in office, a way for you, okay? All right, and that's 90% of your healthcare needs under one roof, all right? Now, the next question is, this is healthcare hack number 2, what about the 10% of care that falls outside the primary care office? So for most adults, about 10% of healthcare needs will fall outside of the primary care office. That will be for surgeries or hospitalizations, or if we need to refer you to a specialist. In our office, we send a lot less referrals just because we have more time. We're not rushed. We're not going through insurance hassles, okay? But about 10% of care does fall outside the primary care office. So people want to know, well, what about that, right? And so that's healthcare hack number 2. Healthcare hack number 2 is the smartest strategy is to customize your catastrophic care plan. Customize your catastrophic care plan. So back in the day, we would just say, you get the PPO, that means you have good insurance, or you get the HMO and maybe it's a little bit more of a hassle, but it's still pretty much good insurance. Well, the truth is there is no such thing as quote unquote good insurance. It's meant to be a financial vehicle, meaning for high cost things in healthcare, surgeries, hospitalizations, or procedure-based specialist office visits. It's meant to make that healthcare more affordable so that you don't go into bankruptcy, right? When something catastrophic like cancer, for example, or a major surgery, for example, happens. So that's when it is, quote unquote, good insurance or not. But what has happened is that insurance companies made it where primary care offices have become a referral center. They cram patients in, they make doctors get in and out the room within 5 minutes. You're incentivized to give a pill or a referral and get people shuttled to where insurance companies make the most money, which is hospitalizations or surgeries, okay? And so what we're doing is we're going back to how medicine should be. We are removing insurance from the primary care office, making that the foundation of your healthcare, all right? Text, email, phone, video, in office, easy access, real relationship, all right? And then hack number 2 is customizing that catastrophic care plan for the insurance, for the 10% that falls outside the office. And it may or may not be insurance. This is where we talk to our members at Inspire about what that customized care plan may need to look like, all right? But I'm gonna tell you our favorite combination. And again, this is general because I would need to know you as an individual to know if this may fit you or not. But for most of our members, if you're an overall healthier individual, meaning you're not on dialysis or you're not currently diagnosed with cancer and going through chemo, like things like that are going to be very high cost very often, then our favorite combination would be a HSA, that's a health savings account, paired with a high deductible health plan. That combination, you are putting the money into your HSA account. I'm giving you game, just write this down. All right, that is a triple tax account. All right, this is a tax deductible benefit. It also builds compound interest. That's why it's a triple tax account. And you can use the HSA dollars to pay for your annual Inspire primary care membership, for example, okay? It is the smartest account to have, all right? And then you pair that with a high deductible health plan, which means that for surgeries, hospitalizations, specialist office, higher ticket costs and care, that is where insurance is being used with the high deductible plan. That is the smartest way for most adults that aren't going through really high ticket, high cost types of health concerns, okay? That is what most of our members here at Inspire Primary Care do. They love using their HSA dollars towards an Inspire Primary Care membership. They're compounding and getting interest off of that in that account. And they're able to use that tax efficiently in their, when it comes tax season. And I know we just went through that. So if you're looking for a smart strategy, I'm giving you the game, all right? This increases the quality of care and decreases the overall cost of healthcare. Another option that many may not know about is health shares. You can look that up. We have a company that we like to use the most for our members, but some members, it may not be that they need an insurance product at all for that catastrophic care, but there are other non-insurance based catastrophic care options, such as health shares. So look into that. And some people also do alternative options like indemnity plans. So these are options to look at, which is why I'm telling you to customize your catastrophic care option. Don't just go to the marketplace and assume you just need a traditional PPO, HMO and assume that that is good insurance, because those now have a astronomical price tag on them. And what they don't tell you is there are less doctors in those plans that accept that insurance. There are less surgeons, less hospitalization contracts, and because of that, it takes people at least 3 to 6 months to use those types of plans and insurance in the Las Vegas Valley. It can be longer. All right, so I'm just trying to give you the way to have the most efficient healthcare, the highest quality healthcare, tax strategy, and the smartest way to actually approach emergency situations, which I know all of us wonder about when we're thinking about exploring membership style primary care. All right, so that's hack number 2. Now, healthcare hack number 3, this is another thing they don't tell you about, so lean in, okay? All right, the healthcare hack number 3 is insurance-free labs, meds, and imaging. And you're probably like, what do you mean? All right, what they don't tell you is if you use your insurance for labs, you are paying at least 10 times the cost for what the labs actually cost, just because they ran it through your insurance, because insurances can have an astronomical unchecked markup on every single thing. So, for example, let me get to that next. I'll come back for examples. Same thing happens with medications. So you pay for a medication, and a lot of times people are like, oh, I pay a $20 copay, or I pay, a $10 copay, and what they don't know is the medication actually costs $3. And so you're getting an astronomical markup simply because it was run through insurance. That's on labs, that's on meds, that's on imaging. Same thing, you get that MRI, it is going to be at least 3 times the actual cost of what the MRI costs. So a healthcare hack number 3 is to at least know about and explore insurance-free labs, meds, and imaging. So what does that look like? What that doesn't look like is just calling a lab or a med or an imaging center and saying, hey, I'm cash pay, what's the price? That's one option, right? That's one option. And it will be less expensive than an insurance-based processing in most cases. But the insurance or the lab imaging or the lab and imaging center, we'll just say in this scenario, will still have their own markup because they're a business, right? But what happens is when you are a member of a membership practice like Inspire, we go directly to the labs, the meds, and the imaging centers. We negotiate the wholesale discounted cash rate just like a Costco would without any insurance markups. All right. That way you are getting all of that at cost. And that is the part, the whole point of a membership is to pass savings on to your members. And so that is one of the many benefits, in addition to your healthcare team being a text away and hearing from us same day when you reach out. But you also have all these other built-in savings, such as labs, meds, and imaging. All right. And so let me give you some real examples because you're like, okay, well, what does that mean? All right. So for labs, for example, a typical full annual lab panel may cost $300 if you run it through insurance. Okay. We've seen these numbers with our members. These are real numbers, not just pulled out the sky. But when you order them through our practice, wholesale rate, not marked up, it's $58 instead of $300. All right. So what about medications? You pay a copay, it's $20. But with our wholesale pharmacy discount coupons, then that same prescription might be $6 to $8. All right. And imaging centers, for example, you may say, I'm going to do my x-ray and I want to process it through insurance. They may charge you $200. But if you get it through our practice, it's only $25. All right. If people want to get a mammogram, we get those during breast cancer month. They're $99 instead of paying $300+ through insurance. And a lot of times people will say, well, sometimes it's covered, sometimes it's not. Most of the time, people have no idea what it's going to cost until their insurance is billed, and they don't know if they're going to get a big bill in the mail later. They don't know if they've met their deductible. There's just so many complex little fine print aspects to those plans, and that's on purpose. That's on purpose because that's the only way that the insurance companies will make the astronomical billions that they're making. And it's not that it's a bad thing, but it's a bad thing that it's being overused and misused and that people don't know that there's another, better, smarter way. So that's why I'm giving you these 3 healthcare hacks, all right? So healthcare hack number 1 was make primary care the foundation of your healthcare plan. If you are an adult watching this, the answer is you should have a healthcare home. My question to you was, do you have a healthcare home that's easy access, easy to text, easy to reach, all right? No hassles, no waits for months. If the answer to that is no, let's lock in your healthcare home. If you're in the smartest way to lock in a quality healthcare home is through the membership model of primary care called Direct Primary Care. And if you're in the Las Vegas area, Inspire would love to be your healthcare home. And if you're looking for a healthcare home and you're like, I'm in an area where I can't find that, telehealth, we're available in Illinois, Missouri, Wisconsin, and Florida. So that was healthcare hack number 1. Do you have a healthcare home? primary care should be your foundation. All right. Drop in the chat where y'all joining from. I see most of y'all joining. Let me know where you're joining from. All right. And then healthcare hack number 2, in summary. All right. We're summarizing. Was make sure we're customizing that catastrophic care plan. If you missed what I said, watch the replay because I gave you all the details on that. All right. I gave you all the tea. I gave you all the tax strategy. All right. Thank me later. And then hack number 3, healthcare hack number 3 was to make sure you are comparing, at least knowing about and comparing the pricing of insurance-free labs, meds, and imaging through a membership practice like Inspire compared to using your insurance. And then, honey, use that calculator and calculate how much you are saving by going through a membership practice, all right? Like Inspire Primary Care. So a lot of times when people are like, why would I pay for a membership when I'm paying for insurance? It's not about not paying for insurance. It's about customizing that catastrophic plan and pairing that with a foundational primary care that is going to make your overall healthcare experience higher quality while your overall cost of healthcare is going down. That is why these are the top 3 healthcare hacks. I just gave you the tea. I just saved you a lot of money too if you actually apply this and look into this. And of course, if you're in Las Vegas, Inspire is looking forward to being your healthcare home. We're now enrolling new members in Las Vegas, and we are also enrolling telehealth members in Illinois, Missouri, Wisconsin, and Florida. Wow. All right. And so tag and share this with a friend, okay? Because this is great information for them to know regardless of where they're at, and especially if they're in the Las Vegas Valley. Tag and share this because it's just such an important time where so many people are avoiding the healthcare system, or they're going to the emergency room, getting these huge bills. People are having bankruptcy because of healthcare expenses. And if they knew these 3 hacks, it could really, truly make a difference. All right. And we are always happy to be a resource. You can text our team at 702-867-0017. You can text us info. We're happy to hop on the phone, Team Inspire, and answer questions you have. We're happy to see if we're the right fit for your healthcare needs, and to just answer any questions you have around these strategies, okay? We would love to care for you, your family, your friends, your coworkers. And if you are a business owner, a small or medium business, or if you are in leadership at a small or medium business in the Las Vegas Valley, we are also the leading primary care office to be the healthcare benefit that's being provided and offered by small and medium businesses throughout the Valley. So we would love to connect with the decision makers in your businesses and show them how we can not only save money for individuals through our model, but also for businesses. And we have amazing tax strategies to save businesses money while also increasing the quality of care for their employees. So connect us with the businesses that you know that may be interested in these strategies, okay? I'd love to connect with you all in the community, okay? We have the Lady Leaders Pickleball meetups that we do every 2nd and 4th Tuesday. The courts are sponsored by Inspire Primary Care. It's a free event for women professionals. Bring your paddle and your water, and that's it. You can bring your other Lady Leader girlfriends. Beginners are welcome, so if you've never played pickleball, it's all good. We teach you while you're there. We also reserve courts for those who are a little more experienced, who already know how to play. It's a great experience. It's a networking experience for busy professional women, and we go out there, we have a great time, wellness, wellness and networking at the same time. It's a vibe. So if you're a lady leader watching this, join us. The next one is this upcoming Tuesday. All right. So we hope to see you there. DM us the word pickleball if you are not in our Instagram group chat, because that's where we put what courts will be at. That's where we put like the updates on what time and where we'll be. So I want to see y'all Tuesday, ladies, at Lady Leaders Pickleball. It's always so much fun. So much fun. And then the other thing is, don't worry, fellas, we got you too. So we also host our Lunch and Learn, our Las Vegas Leaders Lunch and Learn every other month. All right. That one is becoming very popular. Last one was overbooked. Okay. It was standing room only. So we learned some lessons that we have to cap it. We have to cap it at capacity. As much as I want to tell everybody, oh, just come. Sure. Just come. We have to cap the RSVP. All right. This is meant to be a strategic networking experience. Lunch is on us. I do a small hot topic wellness discussion, and we network before and after. And this is for strategic leaders in the community and decision makers in the community, especially if you're a business owner with a team. We'd love to see you there. But if you are a Las Vegas leader, we would love to see you in the room, okay? The next one is June 5th, and we just put the RSVP up. It's in our bio, and we'll put it in our stories too. But we only have limited spaces, and this time I will have to cap it at the capacity. So, and we always have people on the waiting list for that Las Vegas Leaders Lunch and Learn. So if you RSVP, please RSVP with intention, meaning you put it on your calendar and you will be there. Otherwise, we want to be able to have people that RSVP be the people who are actually in the room, so those on the waiting list don't miss out, even though there were seats available. All right, I think that's it, you guys. I hope you enjoyed these top 3 healthcare hacks. Again, watch the replay, drop any questions you have. If they come up, you can DM me questions if you don't want them to be all out in the public. Or what I really encourage you to do is text Team Inspire. Give us a call. We're at 702-867-0017. We're at inspireprimarycare.com. That's how you enroll in our practice. And again, we are enrolling in not only Las Vegas, but our telehealth has launched in Illinois, Missouri, Wisconsin, and Florida, which is wild and a blessing, and we're excited. So we're transforming healthcare one city, one state at a time, and I'm not going to shut up until everybody knows there's a better way. There's a better way, and we're excited to be a part of the solution to better healthcare in our country. All right, I'll see you guys next time. Bye.